Just a few steps from Paris's Gare du Nord stands a particular machine. This is no ATM, but an automatic distributor for the district's drug addicts.
These here are kits to smoke crack. I filled up the machine and in 2 hours it will be empty.
They first made their appearance in 1994, freely providing syringes and crack pipes in return for ones already used. Now they're in use 24/7.
They go through nearly 1,000 syringes a day. Use is always increasing. There hasn't been 1 year when levels have been less than the year before. And I've been doing this for 14 years. It's always going up.
The aim's to prevent the transmission of viruses like HIV or hepatitis. While the machines have certainly helped, they haven't done anything to prevent people using openly in the street and leaving used paraphernalia strewn around the area. It's taken years to get a solution on track, but France has finally started with a pilot scheme for supervised injection facilities, or SIFs.
We are opening a space to be used by those people who inject drugs, who've been excluded, those who we cannot reach with the means of health and prevention that we currently have in place.
There are cubicles to inject narcotics, smoking rooms for crack addicts, a relaxation area, and even a medical room. 100 people a day can pass through the facility on the grounds of a local hospital, all under the eyes of doctors, nurses, and social assistants who can help users who want to quit. Local residents, though, aren't so keen. They fear for their district's safety.
Even more addicts will come here, that's for sure.
And that bothers you?
Well, yes, of course, because things can get really unsafe around here. There's a lot of theft. I can tell you, I work just over the road. It's really not good.
Perhaps it's better not to leave them in the streets, because we see them outside. Children can see what they're doing.
Well, I think it would be better to take care of them medically and then to get them working for the public good, to get them back into some kind of normal rhythm.
Despite such fears, 90 other SIFs worldwide have already proven effective, drastically reducing the numbers of public users. And there's more still.
This place is for people already in this area. The anxiety of local residents who think people will come here from the suburbs really isn't an issue for us, since we know that people usually take their drugs where they buy them.
Here, that's just at the end of the street, at the crossroads next to the Gare du Nord. Addicts inject themselves or smoke there in plain sight. For the ones we met, the new facility means a lot of potential change for the better.
Will help us avoid contracting all sorts of filthy diseases, having to be with people who are more or less clean, some of them who are homeless. Most shoot up behind a little wall over there or in car parks with all the tourists and everything. And when they do it, they don't put it in the bin. They leave it lying on the ground. Even in the public toilet over there, it's not clean. So I think a place to shoot up, it's good.
Others, though, have their doubts, since some people won't be allowed in.
I take Skenan and crack. Skenan's basically got a morphine base, and I smoke crack.
You inject it?
I inject and I smoke. There'll be a big problem because the facility's only for people who inject, not for smokers. So they'll all go out and smoke outside. It'll be a great big mess.
So, crack smokers on their own, no, but if they're injecting too, then yes. We asked one of the socialist MPs supporting the project if that was a paradox. For now, it seems there's not much to be done.
There are different means within the facilities. There are people who inject, but the problem is that there are also people who smoke certain substances. So there are two possibilities in place in this facility, but things will be implemented bit by bit.
They're saying crack smokers will stay outside.
We'll see. First, let the staff get to work.
And if it does work, Paris won't be alone. Other cities like Strasbourg and Bordeaux should see facilities set up in the weeks to come as part of a 6-year-long test run.
Now, for more on this, I'm joined from Amsterdam by Cédric Charvet. He's the coordinator of drug consumption rooms at the Ruggenborg Group. Hello, thank you very much indeed for your time.
Hello.
Now, medically supervised drug injection centres have existed in Europe for 3 decades. What's the impact been in the Netherlands of these centres?
The impact has been only positive. Until now, there are many assessments who have been made regarding the three main goals of those facilities. The reduction of HIV, hepatitis C contamination drastically dropped down since the opening of drug consumption room. There is an extremely low level of overdose within the facilities. Actually, I cannot recall any lethal drug overdose happening since those facilities happened. That means the overdose who are potentially happening happens outside of those facilities, and even so, they are extremely low level. And regarding the public nuisance, which is one of the goals that I think appeal a lot to the French population, it has been an enormous change between the period before and after the opening of such facilities. At the moment, the public nuisance is not even discussed anymore. Eventually, between the facilities and the direct neighbors, for before and opening hours to monitor the movement of users coming and going, but it has nothing to do with paraphernalia left behind. There is no needles in the park. Very few people, almost none, are injecting outside unless they have no other choice. But most of drug consumers come to our facilities. So it's mostly positive.
So you're saying that there aren't just benefits to users, but also to society?
Yes, it goes both ways. When we prevent HIV, hepatitis C contamination among drug users population, we reduce it indirectly into the general public. Don't forget that drug users are not separated from the rest of society. They interact constantly with non-users, heterosexual or homosexual people. They have sex with general public. So any contamination we prevent within a facility prevent further contamination in the general public. This is one of the examples I can think of.
Now, obviously, reducing the health and crime risks associated with hard drugs is a positive thing, but what about the impact on drug addiction?
The impact is also positive. Most of the clients we will see in Paris, the one we see now in Amsterdam, are long-term hard drug users, extremely desocialized, and those people don't have a place to use, I'm talking about an hygienic, safe, and stress-free environment to use drugs. Therefore, they are constantly chasing time, money, and drugs, and not having even time for themselves to think what they would like eventually tomorrow. While they can access a drug consumption room, this allows them to use in a safe, hygienic, and stress-free environment, take a break from the rush and the stress of this constant spiral, and maybe think further. Do I really want that later today? Do I want that tomorrow? And in addition, our facilities are not just standalone facilities. We are connected with many partners, medical, social, psychological partners, who can help to support transition route, how we call it. If drug users fancy a better quality of life and more control of the drug use, or less using, or even stop using, we put directly the person in contact with a partner which is more habilitated to support this transition. But the transition from a life of drug use to a non-drug use is complex. It's a long-term process, and it cannot happen only within the facilities. It's a combination of partners who are working around and in the drug consumption room facilities.
Now, some critics say that this initiative paves the way for the decriminalization and even legalization of certain drugs. What's your response to the critics?
Fine. My response is very clear. The first project that happened in Switzerland, Germany, and the Netherlands has been only possible because of the decriminalization of the use of drug. It will be paradoxal to allow such facilities to operate and still keep on a very repressive approach on the drug use, because that would mean that the government operate facilities where illegal activities are happening. And that is going against our philosophy, if I may say so, or ideology. The idea is to decriminalize the use of drug itself, to allow the drug use to be legal in such facilities, and allow other possibilities of treatment also, and other possibilities for the users to not only be seen as a criminal, but as a human being with a drug addiction problem, which make a very big difference on how we treat the problem itself. Criminalization has only filled up prison and didn't really bring the positive to the users. We know very well about the failure of the war on drugs. We know it all.
Cédric Charvet, I'm afraid we'll have to leave it there. Thank you very much indeed, though, for joining us for today's Focus.